welcome everyone. I'm excited to share here CBD Hyperhope. I hope you all enjoyed our main keynote speaker there with Dr. Grinspoon. I thought he did a fantastic job. All right. So my name is Eloise Theisen, and as mentioned earlier, I am an adult geriatric board certified nurse practitioner. I'm the current chief nursing operator and board president here at the 411. I'm also the CEO of Radical Health and the current president of the American Cannabis Nurses Association. So I'm going to present here in the next 15 minutes to talk about CBD and its therapeutic potentials. And what the research supports. Does it help with certain conditions? Is what you read on the internet actually true? Is it safe? And how do you know how to choose a good, safe product? So we know that CBD can work as an antipsychotic, an anti-anxiety, an antidepressant. It's been shown to help with mood, altering our mood and helping us to feel more pleasant. We know that CBD has been shown to treat things like nausea, seizures, inflammation, neurodegenerative cancers, depression, diabetes, bacterial infections, bone fractures, insomnia, pain, and spasms. In fact, we have more conditions that CBD shows it can treat than THC. We also know that CBD can have some side effects. And in Dr. Grinspoon's talk, he did talk about some of the potential adverse effects when using cannabis. And again, the most side effects I see in my practice are usually dizziness and dry mouth as well. But you can also experience a biphasic effect from CBD. So that means in a low dose, some people may feel alert and stimulated and energized. It can improve their focus. And a high dose can actually make them drowsy. It can suppress their appetite. They may actually have some diarrhea. We may see some tachycardia, increased heart rate. And CBD is most likely to have a drug-to-drug interaction with your other medications. So it's incredibly important that if you're going to be using CBD for chronic conditions, that you have your healthcare provider review your list of medications to check for interactions. We also have CBDA, and this is a lesser known cannabinoid, but shows a lot of promise. CBDA is known as the raw form of CBD, so it hasn't been exposed to heat or processed. And CBDA is thought to be more water soluble than CBD. It can actually be 10 to 20% more effective. So consumers can actually use a lower dose of CBDA to achieve relief, which will help reduce the cost and potential adverse effects. And there's some preliminary research to say that CBDA may increase the effects of CBD. We have a little less research on CBDA compared to CBD. And when we do look at the research of CBD, most of the studies have been in animal studies. And a lot of times the dosages are a lot larger than people can actually afford. Although large doses as much as 1,500 milligrams have been well tolerated, we know that CBDA might be a nice alternative to help keep those dosages lower. While the research is limited, we do know it can help with things like bacterial infections, nausea, and cancer. And in my practice, I've seen it help well with things like inflammation, pain, fatigue, ADHD, and improved cognition. Many people refer to CBD as non-psychoactive, but that's actually not true. Since we can use it as an antipsychotic or anti-anxiety, antidepressant medication, that is considered a substance that is mood altering and in fact is psychoactive. It will not produce euphoria like THC can, although not that that's a bad thing. I want to talk a little bit about CBD from hemp and CBD from the cannabis. Definitely a lot of confusion out there. It is the same molecule, whether CBD comes from hemp or it comes from the cannabis plant. And hemp plants can flower. However, we've historically used them for industrial purposes. Generally, the stalks and stems have been used for rope, textiles, concrete, paper, and a variety of other uses. But the flowers are the best for producing medicine, as it's the most abundant concentration of the CBD molecule in the flowers and not in the stalk and stem. So why has CBD become so popular? We've had this emergence of CBD. It has to do with the 2018 Farm Bill, which descheduled hemp. Interestingly enough, though, the DEA and the FDA did come out and say that they still consider CBD a Schedule I drug, whether it comes from hemp or not. And in response to the descheduling of hemp, we see CBD being sold widely all over the internet, as well as in some health food stores. These products are not tested or regulated, and they may not be safe. They can contain synthetic cannabinoids and other harmful chemicals. So if you're going to choose a hemp-derived product, there are some important things to know first. We currently have 3 types of hemp CBD products on the market: full spectrum, broad spectrum, and isolates. A full spectrum product means that all the cannabinoids and terpenes are found in the plant. It is the closest to the natural plant as possible. Now, hemp is defined as THC that is 0.3% or less. And in a full spectrum product, you will have the THC at 0.3% or less in dry weight. Now, what's important to know about that it's dry weight, as they take the plant and they produce it into like a gummy or a tincture, that can actually increase the concentration of the THC in a full spectrum product. So some of these THC products that are available to you online can have as much as 2 milligrams of THC per milliliter in a high concentrated CBD product. And in some cases, that's enough to produce a euphoric or impairing effect. So these products can sometimes produce more side effects than something like a broad spectrum. A broad spectrum is where they've taken the hemp plant and removed the THC from it. So often they're labeled as THC free. They'll generally contain other terpenes, cannabinoids, and flavonoids in the product. Now, it's important to remember, though, that THC free does not necessarily mean it's free of THC. And there's still potential for some people to test positive on a urine drug screen. So if you are working and cannot afford to have a positive THC urine drug test, you may want to consider what we call an isolate. A CBD isolate means it's just pure CBD. Everything has been removed except for that single molecule. It's often refined into a powder or crystal form and then reconstituted. Now, we have a variety of what we can choose from, and the research, while it's still mainly theoretical, does support that a full spectrum with a little bit of THC may be most effective at treating conditions compared to a broad spectrum or an isolate. When choosing products, it's important that you look for companies that are using independent third-party testing. You want to look for what's called a certificate of analysis. You want to make sure that they're displaying how much cannabinoids or cannabis, THC, CBD, terpenes are in that product. Make sure it's batch specific, that it matches the batch that you're currently using. Also look for things like heavy metals, molds, pesticides, contaminants, residual solvents. Sometimes these companies can use things like acetone, isopropyl alcohol, ethanol alcohol to extract the cannabinoids off of the plant. And we also encourage you to look for products that are derived from high resin cannabis and grown under sustainable and organic conditions. We also recommend avoiding products that may have toxic additives like corn syrup or artificial colors. Now, sometimes the products can definitely taste like the plant, and some people will put additives in there to help with the taste, but you can find companies where they use natural ingredients. Make sure they're not making any explicit health claims. We've seen some companies come out saying that their cannabis or CBD can cure cancer. Early in 2020, there were claims that CBD could cure the coronavirus. And make sure that if you're going to pick a product, that it's derived from the flower and not from the seed and stalk of the hemp plant. We also recommend, if you're new to CBD, that you don't sign up for resources until you're clear how much CBD you're actually going to need. And we also recommend that you avoid the multi-level marketing at first, where you do have to sign up for large quantities of CBD to try to sell and recruit others. Just wait until you know how you're going to respond to CBD, how much you need, and whether or not it actually is going to work. So there are a few conditions where CBD seems to be the most helpful. And in 2017, the National Academy of Sciences came out with their health effects of cannabis and cannabinoids. And in their report, they issued the current state of evidence and recommendations for research. They found that there was moderate evidence in the medical literature that cannabis and cannabinoids are effective at improving short-term sleep outcomes with sleep disturbances associated with chronic sleep apnea, fibromyalgia, chronic pain, and multiple sclerosis. Now remember, CBD can be biphasic, so sometimes low dosages can be stimulating, and some people have reported that CBD can keep them awake at night, whereas larger doses might be more effective for sleep. In my practice, I'll usually start anywhere between 10 to 25 milligrams of CBD at night to help improve sleep. And chronic pain, as Dr. Peter Grinspoon mentioned, chronic pain is very complicated. And using cannabis can be an effective method, especially CBD, although it can take a while before people really find the most effective strategy. Again, the National Academy of Sciences came out with their report, and they found that there was conclusive evidence that cannabis and cannabinoids are effective for the treatment of chronic pain in adults. And CBD in particular has been shown to be effective at reducing inflammation, modulating pain, boosting opioid analgesic effects, and shifting the dysphoria associated with pain. In fact, we have more and more studies coming out where people use cannabis and their opioids together. They find that they can actually reduce their opioid intake. And Dr. Peter Grinspoon also mentioned this in one of his talks, where they saw as much as 18% of people who used cannabis were actually able to stop their opioids altogether. And then, of course, we have anxiety. And there's more and more research coming out around using CBD in particular for anxiety, because it does work with some of our mood receptors, our serotonin receptors. This was a study done in 2019 looking at CBD for anxiety and sleep. And the study was retrospective, but it examined whether or not anxiety and sleep were benefited with the use of CBD. And they used dosages from 25 to 175 milligrams. And they found that anxiety responded better to the lower dosages and sleep responded to the higher dosages. Because cannabis is and CBD is often artisanal, it can be challenging to find that sweet spot. But starting low and slow is always the best way to go. And if you are curious about trying CBD, you can look at our website at leaf411.org to see many of our sponsors who may have booths here today, who have all been vetted and fit the criteria for safe and effective CBD. And those are my references. Well, thank you everyone for joining us.